Look at the green dot.
There you go. Hello. I'm Ayelet Connell, President of Manual Therapy Seminars, and this is our friend and colleague, Tara Collins.
Hello.
Hello. Let's start off with, if you just say a little bit about where you're from, where you practice, what sort of practice you have, how in relevance to IMT.
I'm a physical therapist. My practice is here in Connecticut, down in Bridgeport, and I've been a PT for 29 years and actually started first studying with Sharon 28 and a half years ago.
So, long time.
Yeah. I'm not that old, though, really.
Yeah, you look lovely and young.
Things in my head.
And what sort of clinical practice do you have as far as physical therapy? Like, what sort of people do you work with using IMT?
I own an outpatient practice, I guess orthopedics mostly, but also I treat Lyme and fibromyalgia and GI issues and migraines and just kind of more systemic things. I advertise that I treat conditions not normally treated with physical therapy, since there aren't that many practices that do what I do in that area.
And you integrate IMT into your physical therapy practice, which I'm sure helps people come in that don't normally get all the way better with just physical therapy.
Yes.
So can you say a little bit to us about, if you were chatting with someone who was thinking about studying IMT, but hadn't quite made that leap yet, hadn't quite committed to taking a class or the whole certification, just thoughts, words of why it's valuable to you and what you could offer them as far as words of wisdom.
Well, if they're already coming out of a physical therapy background or physical therapy school, obviously they want to be in a helping profession, but there's just ways for them to be able to help and support their patients in much larger directions, much larger universes, not just seeing someone as having an ankle problem, but kind of helping them literally move forward through their ankle problem. And I think it's also can be very preventative. You can kind of help a patient improve their own health in small increments very gently, but can really have profound effects as they grow older, which we all do.
That's great. And, as someone's going through their learning, let's say they've already decided to take a class or two, and in the beginning, maybe it's vague to you 29 years ago, but as you started learning IMT, and there's just such a vast amount of knowledge there, sort of any words of wisdom as far as getting kind of navigating through the waters of being an early learner?
I think the courses that tend to be a little bit more structurally based, if they're coming out of a physical therapy background, tend to make a little bit more sense. So biomechanics, general myofascial release, but then the idea of applying mobility to other systems kind of quickly comes into play. I mean, my own history, I had a little old lady. So I had been a PT for like 4 months, and she was very obese and had had a total knee replacement done without any supportive therapy before that, and I had to get her range of motion back, and she would cry. So I figured there had to be a kinder, gentler way. So the original IMT courses I took, and they're not offered in this version as far as I know, but in an online way you could do the same thing. You take a little bit at a time. I would come on Wednesdays.
Oh, with the 6-week evening classes.
Right.
Oh, yeah.
Way back. And then you got to go and experiment. Experiment. I've never been comfortable with the word play around with something.
Yeah.
But just to try it out on a few patients and then come back and report back and potentially get feedback and then learn a little bit more and kind of build on that.
We might have to resurrect the 6-week evening classes.
I thought
they were great. Yeah. Well, thanks so much, Tara. We really appreciate you doing this.
You're welcome.